Okay, so this commenter here says, I don't want universal health care. Can I ask you why? And I'm being sincere. I don't want to have an argument with you. I want to have a conversation with you. Why? Why do you want to keep a system in place that causes Americans to pay much more than every other industrialized nation for our healthcare and get worse results? Why do you want to advocate to keep that system? Not to mention the fact you have in your bio that you're a breast cancer survivor. First and foremost, congratulations. I hope many, 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 many more people that have to face that ugly disease have an opportunity to put that very same thing in their bio, that they beat it. But why wouldn't you want to make it easier on people that have the ailment that you have? Universal health care helps breast cancer patients by improving access to early screening, reducing out of pocket costs, and ensuring timely diagnoses. Going back to my first point, here in the United States of America, we pay nearly $15,000 per person more for our health care, nearly double the average of other high income countries. So, can you please explain why you don't want universal health care? I I've never been able to understand why anybody in this country would want to advocate for keeping the existing healthcare system in place. We don't see anybody from any other country trying to replicate our healthcare system. Yet we are constantly trying to replicate other people's healthcare systems. You know how many people are going to go broke because they get some type of cancer diagnosis? How many people that aren't going to be able to get the care that they need because they don't have the coverage? Do you know how many people in this country don't go out and start a business because they can't afford the healthcare? Maybe it's a plumber that's like, hey, I can break out and do my own plumbing. I got my own tools. I got a van. I've got my knowledge, but I can go make some money, but I can't make enough money to pay for the healthcare. So I got to stay working for this guy. Maybe there's somebody out there looking to start a restaurant in town. They've got a great idea, a little mom and pop restaurant, but they can't do it because while they have enough money to start the restaurant and get it up and running and actually make a little bit of money doing it, they can't afford the health insurance to begin with. Why would you want to advocate to continue that? And why wouldn't you want to see people, women, coming after you that are going to face that same deadly disease, that are going to face that same fear, that are going to find a lump one day and go to the doctor and have their worst fears confirmed? Why wouldn't you want them to have an easier time battling this illness and tackling the costs that come with it and the care that they need to get than the people that came before them, like you and all of the women that came before you? I don't understand the thought process. I'll break the math down again. If for everybody else, not just you, if you take a piece of paper and on one side of the piece of paper you write down everything, let's just call it over the course of a regular month, everything that comes out of your check for Social Security, everything that comes out of your check for Medicare, everything that comes out of your check for Medicaid, the monthly premium that you pay for your health insurance just to have it, and any out-of-pocket costs that go with it. Every time you go to a doctor or a specialist, or you buy a pharmaceutical, or you, God forbid, have to go to the hospital or take an ambulance ride, you add up all of those costs on one side of the aisle, one side of the paper. And on the other side, you write down what 10% of your income is before anything ever comes out of it. And tell me which one is cheaper. Because that 10% on the right side, that could get us universal health care. Universal health care in other industrialized nations take care of all of their healthcare needs, a vast majority of their pharmaceutical needs, their hospitalization needs, their specialist needs, all of it. And in the case of some countries like some plans like the United Kingdom, provide a national pension, their version of Social Security. I would rather see people eliminate all those other costs, the monthly premium, their out-of-pocket expenses, their Social Security deductions, their Medicare, their Medicaid deductions, all of it, in favor of them paying 10%. And their employer paying another 10 or 15%, like in these other industrialized nations, and everybody's covered. You get to walk into any doctor, any specialist, any pharmacy, anywhere. Now, you still have, in some instances, you still have a primary care doctor, and you can't just be like wandering around from one doctor to another. But for example, my stepsister, who lives down in the southern part of the United Kingdom near London, specifically in Cambridge, they were up in Scotland a handful of years back for the solstice. They were out there fucking around and playing rugby and having a good time, and one of the people in their group of people broke their arm, and they had to go to a local hospital and get treatment and get medication up there. Yeah, no problem. This is me. I'm a resident. Why would you not want that? Can you please explain in the comment section why you don't want universal health care?